Sensitive content warning. We talked about male testicles, now let's talk about female reproductive health and COVID. This is the paper we're going to be looking at, Female Reproductive Health During the COVID-19 Pandemic, Latest Evidence and Understanding. This is a 2023 published paper, but it was accepted in October 2022, so there's a little bit of a lag here. Most evidence is showing that COVID does not infect female reproductive systems. However, the virus may indirectly influence sex hormone concentrations through inflammation, and we've also seen menstrual disorders in women infected with COVID, where the authors recommend that women of childbearing age be vaccinated with the COVID-19 vaccine, but really everyone should be vaccinated with the COVID-19 vaccine. I don't like this phrasing. And they want to highlight that the COVID-19 vaccine on menstruation is no different from the short-term and reversible side effects of any other vaccination. So if you are having a vaccine-related menstrual change, that is no different than what you could experience with any other vaccine. Several studies have not detected the COVID virus in oocytes, the eggs, and also in cervical cells in female patients with COVID. And numerous studies have taken vaginal swabs and have not detected COVID in people that were pregnant or non-pregnant that had COVID. So unlike males who are going to have COVID attaching to their sperm, which could be sexually transmitted, women will not have the same thing if they have COVID. Their vaginas will not be transmissible of COVID or for COVID. Interestingly, some women have had high concentrations of their sex hormones, such as follicle-stimulating hormone, FSH, and luteinizing hormone, LH, and prolactin, which may indicate ovarian suppression in these patients. And they're thinking this is sort of a secondary result to direct impact on brain tissue. So damages to the brain might be causing these hormone imbalances that we're seeing in female patients. For menstruation, we're seeing worsening premenstrual symptoms, prolonged menstrual cycles, and decreased volumes, where some women that were infected with COVID are having higher levels of irregular periods and higher levels of missing periods, in addition to higher levels of menstrual pain. Many studies are finding evidence that this is short-lived, however, where one study showed that 99% of patients return to a normal cycle within 1 to 2 months after contracting COVID, and that another study following that is sort of stating that these are transient changes and there should be a recovery within a short period of time following COVID in regards to these menstrual changes. But this is something that is still not overtly clear. It's still something that's being studied. For instance, what about long COVID patients? Are they going to have long-term menstrual changes? These are things that are still being investigated.